Going to introduce our next speaker, Dr. Dan Bilsker, Clinical Assistant Professor at the University of British Columbia. He's a researcher with a mental health focus group at SFU and works as a clinical psychologist here at VGH. Dan?
When I first took on this project, I didn't really know exactly what to expect. I knew this was an important area. I was very excited by the kind of initiative that was being taken by this group to open up this new perspective. As a psychologist who's worked in the emergency psych unit for a number of years, been involved in the health system, and been involved in various attempts to change the system, I thought I knew a lot about what healthcare looked like, what the overall patterns are, the epidemiology, the statistics, and so forth. And it's remarkable how little thought I ever gave to the difference between men and women in terms of their health outcomes. I've, of course, as everyone has, heard the statistic about men dying significantly before women, and of course that would apply to me as well. But like most people, I assumed that was just how it was. That was just a given, and it wasn't even something that needed to be thought about very much. There was some kind of a switch inside me that was going to switch on before women and I would just die earlier, and that was just it. So doing this report has been quite extraordinary because it's caused me to sit back and think not just about my own life expectancy, but about all the patients I've seen over the years, men and women, and how these gender-based factors have been affecting them and changing the course of their health and, what I know best, their mental health. But it's caused me to sit back and realize how little I've known as a psychologist and as a researcher and as a clinician about men's health in particular. So this report that I've been working on for the last 6 months and kind of wrapping up now has actually been quite an extraordinary thing to be working on. It's been amazing. Let me talk about some of the things I've learned if the mouse chooses to work. Okay, there we go. So we'll start with that statistic. It actually seemed like a good place for me to begin with the report, because when you say you're going to do an overview of men's health, it's potentially gigantic. It's potentially the size of all of health, and that's a pretty hard report to write. So I needed to have some focus for really emphasizing what was going to be the key issue here. And it really seemed like a way to begin was with that average 4.5-year reduced life expectancy for men compared to women. In a sense, I constructed it in my mind as a kind of a population-level murder mystery. What's killing the men before the women? What's doing this? Where is this coming from? Let's not assume it's just a natural given, just how the world is. Let's assume there's a reason for this, and that men could, in principle, live as long as women, and let's find out what's making the difference. Overall, men have higher rates of mortality for all of the leading causes of death, and a number of those kind of tables have been produced, and you saw some of those statistics showing that men die at a higher rate for all those different kind of very serious and fatal disorders. But it's also true that men's health has received much less research focus than has women's health. And there's a little graph I've got up there. It's the one that Larry showed before, which shows the percentage of funded research that is allocated, described as women's health research, which is about 52% of the funded research in this country. That's gender health research, and with a much smaller statistic. There's about less than half of that for the male research that's described as men's health. So we have an underfunded area where there really hasn't been enough research to understand this area, which would help to account for the fact that I found myself not really having a firm sense about what those key differences were. And I think only in the last 10 years has there been a real call for a focus on men's health as a crucial area for research, for policy, for clinical practice. So that's the overall context. A lot of the men's health advocacy has been taking place in the UK, or it's been happening in Australia. You have some men's health policy and some calls for this kind of research, but it's really fairly recent. We're talking about what's been going on really over the last decade, that this has been identified as an important way to look at healthcare and to allocate resources and research funding and so forth. As you probably know, there's been a women's health movement and perspective for a number of years, and it's had wonderful results. Some years ago, a number of women recognized there were certain areas where women had far worse outcomes, were not receiving very good focus in the system, their needs were not being met appropriately, and they called attention to it, and they organized, and they influenced policies and politicians and healthcare researchers, And now it's very much a part of the system. It's part of how research is funded. For years, I've just taken it for granted that if I would go and sit at a government table where policy was being discussed, somebody would be there representing what was called the women's health lens. And it really made important differences in what we did. That person would talk about how this would relate to women's needs and women's access to the system, and we always had to take that into account. Well, there was nobody sitting at that table representing men's health. That was just assumed to be a baseline. And I think it's really not that simple. And as we go along, you'll see why there really is a men's health lens or a men's health perspective that really should be taken into account. One of the things that was important to do in this report is to specify what the domain is. What is the range of what we call men's health? What sort of things do we need to cover and talk about? Well, first of all, men's health, of course, is identified with male-specific conditions. And often when you read about men's health, that's what people are talking about. They're talking about prostate cancer, testicular cancer, hypogonadism, and I think you'll hear more about these later, male sexual dysfunction. These are topics that are going to be very well covered by some of the experts who are here today. I'm not going to spend a lot of time on this area of men's health. It's covered in the report, summarized, talked about, identified in terms of key issues. What I'll talk more about is what I call the male risk conditions, the conditions for which being male is in itself a significant risk factor in terms of worse outcomes, increased mortality, and so forth. There we're talking about cardiovascular disease, we're talking about suicide, motor vehicle accidents, osteoporosis, lung cancer, and HIV. So those are the male risk conditions that are talked about in the report. The report, of course, will be available, I'll point out, probably in January. We'll have it up on the website so you can look at it for download. We want people to get this information, to think about these facts, and just to be exposed to these kind of issues. So let me talk about what some of the factors might be in trying to understand why men die before women. In a framework for understanding it is, first of all, there are biological factors. Obviously, biological differences between men and women. There are hormonal differences, of course, and we'll mention a bit later about the idea that estrogen might be cardioprotective and therefore women have more protection from heart attack and so forth. There are brain structure differences. A lot of it is hypothetical, but researchers are beginning to explore how men's brains might from the very beginning be built differently from women's, and that would affect their behavior and attitudes and the kind of trouble men get into. And of course other physical differences like increased strength that might lead men to be hired preferentially into certain kind of more dangerous jobs, etc.